Thank you so much, everyone, for joining today. My name is Ronit Karmakar. I am the Vice President of Graduate Student Government. And with me, I have Shreya Joshi. He is the Research Chair. It's 5 minutes past 5:30, so we'll get started with our info session today. Just a couple of housekeeping points before we start. Shreya and I will keep an eye on the chat. So if you have any questions, you can either directly send it to either him or me, or you can post it to everyone. We will note those, and in the end, I will try to get all of your questions answered. From Blue Cross Blue Shield of Michigan, we have Darrin and Tammy with us. Thank you so much for joining. And they will present for the first half of the session today. And then after that, we'll have an open floor. So if you have any questions, please raise your hand at that time, and we'll unmute you and then can ask your question directly. With that, I will let Darrin and Tammy take the lead and start presentation.
Awesome.
Thank you.
Well, thank you so much, Ronit and the GSG for inviting Blue Cross Blue Shield of Michigan to participate in this wonderful student insurance information session. My name is Darrin Eaton, and I'm the Client Engagement Manager here at Blue Cross Blue Shield of Michigan. I lead the team that manages our student health insurance business. And I have with me today one of my colleagues, Tammy Yates. I will let her introduce herself, and then she will walk us through the benefits that you have with regard to the Michigan Tech Student Health Insurance Plan. And I will also start sharing my screen. So Tammy, the floor is yours. And you're on mute.
Okay, saw the mouth moving, but no words. Here we go. Hi, everyone. I'm Tammy Yates. I have had the pleasure of being with Michigan Tech with your faculty for over 10 years, and it's been a very, very good experience. And it is a good chance to be with you today to talk to you about your specific Michigan Tech University Student Health Plan. Darrin, are you, okay, so you just want me to read as we go through here. I was gonna share my screen, but we're good. So,
Tammy, if you can share your screen, by all means, go ahead and do that.
Okay, I'd prefer. Thank you.
Perfect.
Just
all right.
Give us just a second, guys. Okay. Thank you.
Oh, I'll have to stop sharing.
Oh. There we go.
Awesome.
Can you guys see my screen there?
Yes.
Scrolling up. Okay, great. Thank you. Sorry about that. Okay, so you guys have a PPO plan, which includes medical, prescription drugs, dental, vision, and hearing. And so my time with you today is going to be just a brief overview. You certainly have access to this document, which has a lot of detail in it, but we'll keep it high level for now. And basically what it is it's a PPO plan, which means you will have the best savings if you go in network. You can still go out of network, and for some services, you can get a referral to go in network, and we'll talk about that in a minute. But I want to have you bring your eyes to the attention of these deductibles. So if you are a single person on your plan, you'll have $150 deductible if it's one person in network. It's $300 if you have more than one person. But pay attention to the other side of this document, because if you go out of network, you still have coverage, but your deductibles and your coinsurance has increased significantly. So this page basically talks about what you're going to have for out-of-pocket costs and what your maximums are, right? So if you're going to be paying a lot of money out for services, you want to know if there's a threshold or a ceiling that you'll encounter throughout the time that you have to have services. So basically, everything that you see here in these columns contribute to this annual out-of-pocket maximum, which again, if you stay in network, is $5,000 per member, $10,000 for family, and then If you go out of network, it's quite a significant increase there. So you can expect, of course, before you have certain services, pay a deductible. And then after you pay that deductible, you'll have a 20% coinsurance for most services. These services here are basically what you would consider to be the most usable services under the plan, like if you have to go to the doctor or if you have to go to a specialist, an emergency room visit, or urgent care. These costs are all outlined here in this section. They're also in a lower section too, in which we'll go into more detail. So basically, the only time you don't really have to pay a deductible is when you have preventative services, which is like if you want to go and get your annual exam with your doctor, if you need a pap smear, if you need well baby care or immunizations, mammograms, colonoscopies, all of those, if you stay in network, are paid at 100%. Notice if you don't stay in network, this out of network, they're not even covered, or most of them are not covered. And you cannot even get a referral to do these. So it's real important that you keep your routine services with a participating PPO provider. And then this section basically outlines in more detail the most common services. If you go to a physician, it's a $20 copay. If you go to a specialist, it's a $40 copay. Online visits is a $20 copay, but you have the convenience of not having to leave your home. We can certainly talk through how to do that. Urgent care visits, a $35 copay. Medical emergency care, you'll notice in these blue highlights is the overview of the general benefit. Ambulance services, you of course have coverage for it, but you have to pay that deductible first, and then we reimburse at 80%, which means you have to pay 20%. Same with diagnostic services, you'll see a pattern going here. If you go in network, it's less expensive than if you go out of network. And all of the hospitals up there participate with Blue Cross Blue Shield of Michigan's PPO plan. So there's no concerns there if you have to be sent to a hospital to have services. Prenatal care, of course, this is when a mom goes into the doctor and gets her belly measured every month or so, every trimester. And then those prenatal care visits are all covered at 100%. Postnatal is covered at 80% after you meet the deductible, and the delivery care and nursery care is covered. Again, the deductible and coinsurance applies there. Hospital care is outlined there. If you have to go in and stay in a hospital, there's unlimited days. And again, it's 80-20 is basically the verbiage that we use for the in-network services here. Inpatient care, and if you need chemotherapy, again, it's covered at 80% after you meet the deductible. And this might be a good time to remind you is, will I pay 80% for the rest of the year? No, there's that $5,000 cap for the out-of-pocket max that was on the first page. So there is a limit to how much you would be paying out of pocket. Alternatives to hospital care, this is skilled nursing, hospice, infusion therapy, home health care, again, covered at 80-20 after deductible. Surgery services, again, 80-20. There's some variations here. You want to just pay attention to the details on here. Like if you need bariatric surgery, it's covered at 50% in network, but there's a lifetime maximum of 1 bariatric procedure per member. So some of these categories in here have nuances that you want to just pay attention to and review that will help you to understand your plan better. So human organ transplants, 100% coverage. Bone marrow transplant, a little bit different than a human organ transplant, but again, 80-20 after deductible. And then behavioral health. This is inpatient. Behavioral health, of course, is counseling if you have a mental health situation or have substance abuse that needs to be addressed. All covered in and out of network, 80% after you meet the deductible. So autism, we covered that. Again, there's specifics in here about the plan and what it covers. And then even though this particular category reads other covered services, there's a lot of services within this category that are important for most people. Diabetes management, 80-20 after deductible. Chiropractic, allergy services here, 80-20. Chiropractic manipulation, notice that it's $30 a flat copay visit, but the out of network is a completely different formula for what you're charged. So just pay attention to make sure that your providers are in network and you won't have to worry too much about it. And then there's a limit on some of these services. For example, the chiropractic has a combined 30 visit max per member per calendar, and that's actually combined with physical and occupational therapy. So if you're someone who frequently uses these services, this is important for you to know. Durable medical equipment, you want to find a supplier in the area that does do billing with Blue Cross Blue Shield. Again, it's 80/20 after deductible. So that basically covers the medical side. Do we want to stop there for questions or keep rolling, Ranit? Guess we'll keep rolling.
Yeah.
Okay, so for prescription drugs, basically what you'll want to know here is try to stay with the generic drug as often as you can and use the mail order program that's available for you as often as you can. So if you go and need generic drugs, it's a $10 copay, but if you get a 90-day supply, if that drug qualifies to be filled at a 90-day supply, you'll save yourself some money because you'll only have to pay a $20 copay instead of $30 for a 90-day supply. And our mail order supply companies are very good where you don't even have to leave your home. You just talk to the doctor, have them forward a fax prescription to our mail order company, and the drugs will come to your door and you can pay by credit card over the phone. So there's a lot of convenience to getting a 90-day supply. We highly encourage it. So if you find that you can't take a generic drug, there's a you're going to find that as you go along this scale, because you have a 5-tier prescription drug plan, the higher you go with the drug, the more you're going to pay. For example, these preferred brand name drugs typically don't have a generic yet. And so you're going to pay $40 for that drug versus if you can get a similar drug that is generic, you can see the cost savings there. There's also a 3rd tier here for non-preferred drugs. There's, you'll see that it's an $80 copay. And then when we get to the even more expensive drugs, which are specialty drugs, you'll start to see the formula switches from a flat copay to a % copay. So what that means is you're going to pay 15% of the drug, but not more than the ceiling that they've put on this tier 4 of $150. Same goes for tier 5. Again, it's a non-preferred specialty drug, and that's a 25% cost, but no more than $300. So hopefully that's simple and clear for you on there. These just talk about the federal drug program and the features of the plan. So we can skim by that. And then we're going to talk about your dental services. So your class, there is no deductible for dental. And whenever you go to get your teeth cleaned and get your first set of mouth x-rays, that's called class 1 services, and it breaks it down below, but I just want to give you the general overview here. There's no cost. So that's a pretty rich plan to be able to go and get your teeth cleaned for free. Class 2 is if you need a filling or other services, that's at 50%. Class 3 is if you need a crown or bridges, that's at 50%. And class 4 is braces, and that's not covered under the plan. You do have $1,000 a calendar year for each of the 1, 2, and 3 classes combined. So if you go get your teeth cleaned and you need a crown, you'll want to just realize that crowns are not cheap, right? They're like $800, $900 here in Central Michigan. So I would imagine a cleaning and a crown and a few other services might put you over the edge. So just know that we've got a support team in our dental area. It's on the back of your card. You can call and find out where you're at with your maximums and talk through any support that you need with our dental team. This is a class 1 outline of what these services are. You can see it's basically a lot of chatter, but it's services that are paid at 100%. And it's basically your cleanings and x-rays. Class 2, again, this is for fillings and other items, 50%. And then class 3 is typically crowns, any type of bridges, soft tissue grafts. And then again, 50% is what you would be responsible for. And orthodontics or braces is the class 4, which is not a part of the plan. So that is your dental coverage. And your vision coverage,
Tammy?
Yes, go ahead.
Before we move to the vision, we have 2 questions for dental.
Okay.
So I'll read them to you. First question is, what kind of services are covered for dental care, like pediatric dentist, cavity filling for kids, etc.? Are they covered if the dependents are added in the insurance?
Yes, dependents are covered.
Okay.
And it doesn't matter what age. I guess I wanted to address that other piece of that question. You know, that it could be a moving, how old your child has to be to go to the dentist is between the parents and the dentist. There's not age restrictions on any of this type of coverage. So it does cover pediatric as well.
Okay. The second question is, what class is fixing a broken tooth?
It's my understanding a broken tooth would require a cap, and that would be class 3.
Okay. We have one more that is, wanted to double check that the invisible braces are considered class 4 or not covered.
They would be considered class 4 and not covered.
The question was and not covered. I'm sorry, I misread. Yeah.
Right. Invisible braces, it's like Invisalign. That is a part of an orthodontia service, and those are not covered under the plan.
Okay, thank you.
You're welcome. Okay, so on to vision. So you have 2 types of vision plans. One is for pediatric and one is for adults. So under the adult, you have a $5 exam. Prescription glasses, which includes the lens and frames, has a combined $10 copay. And if you need contact lenses, it's a $10 copay. Our network is VSP, and there's a phone number on the back of your card along with the number here on our benefits at a glance for you. And you guys are extremely online oriented. I've learned with your faculty, we have over 75% of the faculty there that use our online tools. And I suspect that would be the same for the students. So we encourage you to go online and try to find a doctor or an eye doctor in your area. So I just want to mention that to you, because in every section of this particular document, there's a support phone number for you to call in case you have questions about either your plan, in addition to your regular customer service line through Blue Cross and Blue Shield of Michigan. So the eye exam again is $5 copay, lenses and frames. It talks about specifics in here, but the most important thing to know is that you have a $10 copay, and you get 1 pair of lenses with or without frames every 24 consecutive months. So this, the 12 consecutive months and the 24 consecutive months can get confusing, because if I have glasses today on September 14th of 2021, I'm not eligible again until 2023, because it's a 24 rolling month calendar that the system will watch for. And you want to always wait 24 months and a day from your last appointment to make your new one, at least to get the lenses and frames. You'll notice up here for your eye exam, that's every 12 months. So you don't have to wait 2 years to get your eyes checked. Okay, so the pediatric up here, you'll notice this is a pediatric. It's a very rich plan. Kids can get eye exam, prescription lenses, and medically necessary contact lenses without any cost share. And so this particular document just talks about what the limitations are. And then we have hearing. So hearing does not have a deductible, and there's a copay of $500 for each hearing aid. And so again, you want to make sure that you go to a hearing provider that's within our network, so that you're allowed to get an audiometric exam, the hearing aid evaluation, and the hearing aids are covered at $500 for each hearing aid. So that is the rest of the benefits overview. Are there any questions?
Hi, Tamara, this is Amir. Like just a follow-up question on the dental services. Like, I just wanted to reconfirm whether the pediatric dentist services, are they covered under like service 1 or service 2? Like if I need to take my child to a pediatric dentist?
It's my understanding, as long as the pediatric dentist is accepting the child of your age, it's going to follow the same plan for the services that are covered.
Okay. Okay. Thanks.
And go ahead.
Yeah, you can go ahead. Like I have another question. You can come.
I was just going to say, if you have any questions or concerns about that, you certainly can give us a call, which is the number on the back of your card, and we can talk through what exactly it is that your child is experiencing, so that we can address that when we can talk right to our dental area and make sure.
Okay, thank you. I have another question. Like right now, I have not added my dependents on my card. So is there some time limit, like before I have to add them?
Well, there, and I'll handle this one, Tammy. You can add dependents at any time, so long as it's during the open enrollment period. And for Michigan Tech, the fall open enrollment period ends on September 30th. I think there's only 30 days in this month. So at the end of this month. So if you wait until after that time, then the only time you could add your dependent would be if there were sort of a change in their insurance status. For example, if they lost other coverage elsewhere, then you can add a dependent outside of the open enrollment period. So hopefully that answers your question.
Yeah, thanks.
You're welcome.
Darrin, I have a follow-up question here. So can you tell me what is the enrollment deadline for spring and summer semester?
Sure. Let me share my screen. Okay, let's see, where are we at here? Okay, everyone see my screen?
Yes.
Okay, great. So what I'm doing now is I am going to the enrollment, or actually what we call the landing page for the Michigan Tech Student Health Plan. And so that can be found at www.bcbsm.com/Michigan Tech. And so here on this page, there's a wealth of information, but if you scroll down a little ways to Plan Overview, right here, click on this PDF, and hopefully you can see this. Can everyone see the PDF?
Yes.
Okay, perfect. So on the second page, here we have the enrollment dates, coverage periods, and the cost. And so, the fall and so you can, and actually let me back up a little bit. So the graduate students and the international students at Michigan Tech are all required or mandated to have the student insurance. I do believe there's an opportunity to waive that coverage if you can demonstrate that you have coverage elsewhere, acceptable coverage elsewhere. So for those particular individuals, the school enrolls you automatically. So for you, for those who fall into that category, what we call the mandated students, the enrollment dates aren't as important for them as an individual. However, for their dependents and for those who are voluntary students who aren't required to have the insurance, but they want to enroll, then that's when these enrollment dates come into play. So for the annual and fall and slash fall spring, enrollment began, meaning the enrollment portal, and I'll go to that site in a little bit. The enrollment portal opened up on July 1st, and it will stay open until the end of this month for the annual, the fall, and the fall spring coverage periods. And so once this closes, the enrollment portal won't open back up until January 1st of next year to allow you to enroll either yourself or your dependents in the spring or spring-summer coverage periods. And the enrollment portal will stay open for those periods for only 1 month, and then it'll close. And then the next time you can enroll would be in May for the summer period. And again, that open enrollment period only stays open for 1 month. So, so again, this document can be found at bcbsm.com/Michigan Tech. Does that answer your question?
Yes, thank you so much. And as I look at this document, it can be also found on the Michigan Tech's Health Insurance's website.
Okay.
It is listed as the BCBS plan overview. Thank you.
So getting back to this, this document, this first page basically gives you an overview, a high-level overview of what Tammy just covered. And, you know, it really just focuses in on for what most people are concerned about, which is what are the costs that I potentially have to pay out of pocket for, for the most commonly used services. So you have a really good snapshot here of what those potential costs may be. And then again, on this page, you have the enrollment and the rates information. So if we go back to sort of the enrollment process, so again, for those who are not mandated to enroll in the plan, or those who may be enrolled by the school, but they want to enroll their dependents, then again, you would go to this landing page, would click the green button, Enroll Now. This is going to redirect you to our vendor partner that we work with Student Health, Relation Insurance. And then once you get to this page, you would click the Enroll button right here. And then you would begin the enrollment process. You would just click out a few of the disclaimers. And then once you got to this page, then you would select what sort of category of student you are. And then here you would, so let's just say I'm a domestic undergraduate. I am enrolling myself and one or more dependents. I'm not sure why that took me. And then we would select the term. I'm going to only select the fall coverage, and we would continue, and that would take us to sort of the shopping cart. And I would add myself, which is the enrollee. And let's say I have 2 dependents, so I would click that twice for 2 additional family members. So I'm enrolling myself plus my wife and my child. And then I would click Check Out. And that would take me to step 3, which is completing this information. And oh, by the way, Social Security number, that's optional. You do not have to fill that in. And then you would click Continue, and you would continue through the process until you got to the payment page, and you would facilitate payment, and you would complete the process, and you would receive a confirmation email that you had completed this process. Now, in terms of when your coverage would actually become active, you or your dependent's coverage, once you finalize the process, it takes approximately 3 or 4 days for your information to, process through the various systems. Not only does it have to process through Relation insurance system, but then Relation sends us what we call an enrollment file, and all of that information is auto-loaded to our system at Blue Cross. And then once that happens, then usually within 24 hours or so, your coverage is actually active. And once your coverage becomes active, you will receive a second email from Relation that will contain your enrollee ID. It's a 9-digit number that usually begins with the number 9. And you would take that enrollee ID and you would go to, you would go to BCBSM.com. Well, actually, I'm sorry. You go back to this page. So you have your enrollee ID. Then you would click this top blue button called Register. You would go through the process to register for your Blue Cross Blue Shield member account. And again, on this page, all you would need is first and last name, your date of birth, confirm an email address. And then for those who did not provide their Social Security number when they enrolled or when the school enrolled you, you would click, I don't want to give my Social Security number. And then once this changes over, you would just input your 9-digit enrollee ID. And then when you click continue, it takes you to another screen where you would input your current address, that sort of thing. And then you would click the button and you would complete the process, and you would then be registered for your online Blue Cross Blue Shield account. Within your Blue Cross Blue Shield account, you have access to a virtual ID card. So while you're waiting for your plastic ID card to be mailed to you, you can create your online account, and you can go obtain, you could access your virtual ID card and print it off, or you can just access it via your handheld device, and you can show your doctors in the pharmacy. So you don't have to have your physical plastic ID card in your hand in order to receive medical services. In addition to your virtual ID card, there's also other information on your member portal account, like once you start seeking services, receiving care, you'll get explanation of benefits and paid claims information. There's also plan information in terms of a running tally of how much you've paid in your deductibles, in your co-insurances, and all that gets your out-of-pocket maximum. So there's a whole lot of information on your online member portal account. But I think the main thing that I want to impress upon everyone is you do not need to have your physical ID card with you. You can download the Blue Cross Blue Shield of Michigan mobile app, which is BCBSM, and you can access your online account via the mobile app. So I do it all the time. I rarely carry my plastic ID card with me. Whenever I go to the doctor, I just pull out my phone, pull up the BCBSM mobile app, log into my account and show my ID card. You can show the front and back of the ID card. The other thing I want to mention is that if you have more than one person on your insurance contract, for example, if you have your spouse and or you have children, you're going to get an ID card for each person that's on your contract. However, every ID card will list only your name. So your spouse's name will not appear on your ID cards. Your children's name will not appear on your ID cards. However, when your doctor or dentist or whomever pulls up your contract information on their online systems to check your coverage, they will see, oh, your spouse is on your contract or your children are on your contract. So just wanted to mention that. Getting back to the landing page, once you've registered your online account, you could either go to bcbsm.com and access the member portal, or you can come back here to the landing page and click log in, and then you'll be redirected to this page to log into your member account. So if we scroll down a little bit further, one of the other items that's that most people have an interest in is determining which doctors or other medical providers that are within their area participate or are contracted with Blue Cross Blue Shield of Michigan. So here, if you're within the state of Michigan and you're looking for a Blue Cross Blue Shield doctor, you would click this top link here in Michigan, and it would redirect you to our Find a Doctor tool at bcbsm.com. So if by chance you're not already enrolled in the Michigan Tech Student Health Plan, you would click here, search without logging in, and you would be redirected here. And they're going to ask you a series of questions. So we'd start here. We would first choose our location, and let's say Houghton, Michigan. All right, Houghton, Michigan. Yes, this is correct. And then we would click, let's see, we would find our plan. Oops. Okay, so this doesn't allow, okay. So we would find our plan, and let's see if the Michigan Tech Student Health Plan is located in here. I don't think it is. Okay. So let me go back. And let's just go back here. So, so we have Houghton, Michigan. So doctors by specialty, doctors by name, places by name, places by type. So let's say we're looking for a pediatrician. And we would just click here. And then this would pull up all of the pediatricians who are contracted with Blue Cross Blue Shield of Michigan that are within 25 miles of Houghton, Michigan. And every single provider, every single doctor that appears in these search results, they accept the Blue Cross Blue Shield of Michigan health insurance ID card. So all of these would be considered in-network. Okay. And then if someone gave you the name of a doctor, one of your cohorts, they said, hey, I go to this person, I really like it. I really like them, and you want to double check to, see if they're within the Blue Cross Blue Shield network. Then you would just go to doctors by name, you would input their name, click search, and then if that doctor pulled up, appeared in the search results, then you could rest assured that they are an in-network provider. So that's the Find a Doctor tool. So a couple of other items. So if you're outside of Michigan, so for those of you who, may who are from, a state, or, who may be traveling outside the state of Michigan, or may live in a different state when you're not in school, and if you clicked this PDF, this will give you instructions on how to find a doctor that's located outside of the state of Michigan. Essentially, you'd click this link, and you would go to this Find a Doctor page, which is at the Blue Cross Blue Shield Association website, which is BCBS, no M, BCBS.com. And then you would click here in the United States, Puerto Rico, and Virgin Islands. And by the way, outside of the, United States as well as its territories, there is no Blue Cross Blue Shield provider network. So this screen looks very similar to the screen at Blue Cross Blue Shield of Michigan. But you would choose a location and plan. And here we would say, let's say Chicago, Illinois. Yes, this is correct. Then you would look at your ID card and you would input the first 3 digits of your enrollee, the alphanumeric digit, well, the first 3 digits of your enrollee ID, which for your plan is XYQ. Let's continue. Then we have the same menu here. Doctors by specialty, pediatricians. And so outside of the state of Michigan, the provider network for Blue Cross is what we call Blue Card. So here with these results, pediatricians who are located within a 25-mile radius of the city of Chicago, Illinois, there are over 1,343 pediatricians that are contracted with Blue Cross Blue Shield who are within the Chicago area. So if you click on one of these providers, you go through the names, you're like, oh, this name looks interesting. Let's see what the specifics of that person. Let's see if they're accepting new patients, all that good stuff. So, so here is, synopsis of that person's practice, the address, phone number, etc. And here on the right-hand side within this box, it'll let you know if they're accepting new patients or not. Also, here it tells you, which languages are spoken within that practice. Tells you whether the pediatrician is male or female, any board certifications, etc., as well as their education. And again, I indicated that outside of the state of Michigan, Blue Cross Blue Shield contracted providers are part of what we call the Blue Card PPO network. So this just confirms that this provider is a part of that particular network. Then over here on the right-hand side, if the provider works out of any other offices within their practice, it will list them here. So you have a wealth of information at your fingertips. If we go back to the, let me close that down. If we go back to the landing page, so here you have the benefits at a glance. This is the document that Tammy walked us through. Summary of benefits just gives you a synopsis of your benefits. Help documents, how to register for your Blue Cross member account. So for, this is basically what I walked us through when in showing you how to create your Blue Cross Blue Shield member account. Then for other resources, information regarding the Blue Cross Blue Shield mobile app. So member consent for release of protected health information. So, so for anyone who is the age of 18 or older, those persons must give written consent to allow others to have access to their medical information. So, as many of you may know, although you may be a student at Michigan Tech and you may be over the age of 18, mom and dad, they still play a significant role in your life, especially in matters related to health insurance and things of that nature. So, and I tell you, we get a lot of calls from parents that want to, discuss their children's health information, and children meaning, adult children over 18. And so, although, they do have permission, verbal, oral permission from their children to discuss, if we don't have it in writing, we can't disclose any information to those parents. So this document right here is what is used to for the student to allow someone else to have access to their medical information. And then we have the member reimbursement form. So from time to time, I'll click on that. On occasion, doesn't happen often, but on occasion, you may receive medical services that you end up having to pay out of pocket for. And I'm talking about things that are above and beyond your copay or your coinsurance. So long as those services you receive are covered under the Michigan Tech Student Health Plan, you can be reimbursed for those out-of-pocket costs that you paid. And you would do that by completing this member reimbursement form. So you would include, the requested information here. You would include the paid receipt, and then you would just fax this or mail it to Blue Cross Blue Shield of Michigan. And you could expect to receive a check in the mail in approximately 3 weeks. And so again, that check, the amount you receive would be the amount you paid out of pocket minus your applicable co-pays or coinsurance. So that reimbursement form is for your medical services or vision services. And then we also have one for your dental services, as well as prescription drugs. Let's say you had to, you went to the pharmacy and to pick up a prescription, and for whatever reason they said, oh, the insurance didn't go through, or something happened where you had to pay out of pocket for the cost of the prescription. You complete the prescription drug reimbursement form, send that in, and you'll get reimbursed. At the Find a Doctor tool up here, you can find, you know, medical doctors. You can find, you know, behavioral health, you know, mental health, substance abuse providers, etc. But you cannot find dentists through these two links. You would have to go here to find a dentist, and you would basically go through the same process of locating a dentist that is in network. So, and the same thing with find an eye doctor. You click here, you can be redirected to our vendor's website, which is VSP, and you would locate a VSP contracted eye doctor. And let's see, and then if you have questions and all that good stuff. So, so basically that's it in terms of the landing page and how you would enroll and register your member account and all that good stuff. Do we have any questions?
Could you show again where the find a dentist option was?
Sure. So we're here on the landing page, and we would scroll all the way down to other resources, and it's right here, find a dentist. And find an eye doctor, etc. So we click here, and here we are.
I'm sorry, which one is the landing page again?
Oh, I'm sorry. It is not this. It is not this. That right there. But let me go to it again. It's www.bcbsm.com/Michigan Tech. There it is.
All right. Thank you.
Mm-hmm. All right. So, so the other thing I want to mention is that let me pull up this plan overview sheet again. So, so for example, let's say you enroll your dependents or you enroll yourself in the plan, and let's say you select fall. And the fall coverage period began on August 16th, and it ends on January 15th. So starting on January 1st through January 31st, you would actually have to repeat the enrollment process if you wanted coverage that began on January 16th. So for the spring semester. So your fall semester coverage would end on January 15th. If you did not re-enroll, even though you may plan, your intention is to re-enroll prior to when the enrollment portal closes. If you haven't enrolled or re-enrolled by the start of the coverage period, the next coverage period, your coverage will not be active. So if you go try to pick up a prescription, you go see a doctor, they'll pull up your information and they'll see, looks like your coverage has terminated. So, so I just want to, because sometimes students don't realize that they actually have to re-enroll in the plan in order to be covered for, the next coverage period, unless they've selected the annual coverage at the beginning. And then your coverage is active for the entire, essentially the entire school year, but from August 16th to August 15th of the next year. But again, if you're enrolled by the school, then you don't have to worry about that, about missing enrollment deadlines and all that good stuff. You would only need to worry about that for your dependents and or spouse. So in a nutshell, that's pretty much everything that we wanted to cover. So again, if there are any questions, we'd be more than happy to answer.
I do have a couple of questions here, so I'll ask them. And for the audience, if you have any questions, please feel free to put them in the chat, or you can directly send them to Shreya or me, and we'll try to get them answered. So the first question I have here is, how can I add additional dental benefit coverage to our current one for supported graduate students?
Mm-hmm. So this plan that you have, it has what we call integrated dental coverage. Unfortunately, there is no way to add additional coverage to what's already included. So having said that, if you wanted additional coverage, then you would, one would need to go to a non-Blue Cross Blue Shield dental insurance company and see if they would, provide you with what you're looking for. That would, and quite frankly, that would be somewhat of a long shot, because typically if you're covered by one insurance plan, you're unable to, to have two different plans. You're unable to obtain an additional insurance plan from a separate company. Typically, there are exceptions, but for the most part, that's the case.
Thank you. The next question is parental care covered?
Yes. Dental care is covered, and if we look at, go ahead.
Not dental. I'm sorry, I said parental.
Parental?
Yes.
Parental care. So meaning coverage that would provide for, coverage for, taking care of an adult parent. Is that what you're, is that what we're thinking?
Yes.
Yeah. No, the student health insurance plan does not cover. So a dependent can only be covered on this plan up until they're 26 years old, and then they can no longer be covered on the student's contract.
Just to quickly clarify, so the student, so if a spouse of a student is added under the insurance as an additional dependent, then they are fully covered, right? I probably misunderstood the 26-year-old part.
Oh, I'm sorry. Yes. I'm sorry. I'm sorry. Dependent children. I had to. I'm sorry. I have to. Let me qualify that. So dependents other than a spouse are covered only up until they're age 26. A spouse can be on the plan for as long as the student is on the plan.
Okay. And to clarify the previous question again, for the spouse or for the student, is prenatal care covered? And you said no, right?
Well, I guess I'll put it this way. In this example, we have a student and a spouse that's on the Michigan Tech Student Health Plan. The parents of either the student or the spouse cannot be added to this plan. So is that what you're talking about, parental?
No, I said prenatal, Prenatal.
I'm sorry.
When someone is pregnant.
Prenatal. I totally. Yes, prenatal care is covered. Yes, at 100%. Yeah. So if a spouse is pregnant, her care when she sees, her doctor every 3 months, that is covered. Yes, that is covered.
All right, thanks for the clarification. I'm sorry for this.
Okay. Yes.
And the second question is, are visits to specialists covered, and do you have to have a referral for that?
You do not need visits to specialists are covered. Yes, you do not need a referral to see a specialist. So if someone felt as though wow, my chest really has I've got these finals that I've been studying for, and my chest has been hurting. That person could go see a cardiologist without having to receive a referral, as an example.
Thank you. The next is, what is the process of changing a name or physical address if that is printed wrong on the card or it shows wrong on the website?
Right. So it all depends on how the student is enrolled in the plan. So, for example, if the school enrolls the student, that means the school is sending an enrollment file every week that lists every single student who should be enrolled on this plan, that the school enrolls. Included on that file are the addresses, phone numbers, email addresses, etc., of each of those students. So if an address or a name is incorrect, those particular students would need to contact the school to get that corrected. However, if a dependent's name is spelled incorrectly, or a voluntary student has an issue with an incorrect name or date of birth or that sort of thing, those individuals would contact our enrollment vendor and I'm trying to get right here, relation at this number here, and you would just let them know, what the issue is with regard to, the correction that needs to be made, and then they'll go ahead and make that, and they will then send that correction to Blue Cross on the next file.
Okay, thank you.
Mm-hmm.
The next question I have is, if someone purchases the over-the-counter medicine for something like a very mild headache, fever, or a wound, is that covered under insurance, and can they ask for reimbursement?
Tammy, would you know the answer to that? Like an over-the-counter medicine? Yeah.
We do have some over-the-counter medicine that's part of national healthcare reform that's covered, but we would need to know what type of medicine it is. So
the answer would be maybe. It depends on the medication.
Yeah, typically it's not covered. Over-the-counter medicine is not covered, but there are a few exceptions.
Mm-hmm.
Thank you. And the last one I have is, will the HPV vaccine covered?
Yes.
Yes.
Mm-hmm.
All right, thank you. These are the questions I had. Now, again, if anyone has any question, please feel free to add them in the chat or raise your hand, and then I'll ask you to unmute and you can ask your questions.
Mm-hmm. So, yeah, I think I can hear you. Yes.
Okay. I think I have a question.
Mm-hmm.
My question is on maybe traveling. Let's say you go out of the country And yeah, just as an example, you have an accident there. Do you have to be carried back to here so that you can be covered, or you can maybe use that reimbursement form maybe or something? I don't know. How is traveling covered by this insurance?
So whenever you travel outside of the U.S., a service that we refer to as Blue Cross Blue Shield Global Core, that service essentially kicks in. And what that means is that you can receive medical care outside of the country, and eventually insurance, Blue Cross Blue Shield would cover that. However, you would be required in most cases, you would be required to pay for those services up front, and then submit an international member claims reimbursement form for reimbursement of what you paid out of pocket for those services while you were outside of the United States. And again, and so a couple of things that you need to be made aware of is, first, that you'll receive reimbursement only for those services you received outside of the United States that would have been covered if you were here in the United States. So, for example, let's say you received acupuncture outside of the U.S. That service is not covered on your Michigan Tech student plan, so therefore you would not be reimbursed for that. But let's say you went to an emergency room because you were hiking and you slipped and fractured your ankle. So, that the services you received as it relates to your fractured ankle overseas, you would be reimbursed for those. And so if you could look at the screen here, let's see here. Okay. So, and as a matter of fact, we're probably going to update the landing page here to include the international member reimbursement form. With regard to the international member reimbursement form, you would go to www.BCBS Global Core. So Blue Cross Blue Shield Global Core, BCBS Global Core. You would go here, accept the terms, enter the first three letters of your member ID, which is X, I believe it's XYQ. Click OK, and then you would, here's where you would find the international claims form. So you have it in a couple of different languages, and you would click on here, and you would complete this in the same manner that you would complete the sort of domestic claim form, but you would send it to here up top. You would either email it or you would mail it to these areas, and along with the paid receipt. And on the receipt, or at least somewhere, it should sort of indicate what services you received. The good thing is it doesn't have to be in English. So Blue Cross Blue Shield Global Core, they translate the information that a member sends to them. And in addition, on the receipt, it doesn't have to be in US dollars, US denomination. They also do the, the exchange and all that kind of stuff, and determine, how much of that service is, is equivalent to US dollars. So, but the important thing is that you would need to fill this form out and attach the supporting documentation to be reimbursed.
Okay, thank you.
Mm-hmm.
I have a follow-up on that.
Yes.
What's the limitation of the BCBSM global? It has to be emergency services only?
Oh, no, it can be, it doesn't have to be urgent services. So, so essentially it has to be services that would be covered here in the United States.
And the coverage will be out of I forgot what it's called. Like,
do you mean out of network?
Yeah, out of network rate.
Yes, it would. Essentially, yes. Yes, it would be out of network. Yes. Yeah. Mm-hmm.
Thank you.
Going one more time, please, if you have any questions, please feel free to put them in the chat or unmute yourself and ask directly. Otherwise, we'll just wait for 2 more minutes. Going once, going twice, going thrice, seeing none. Thank you, Darrin and Tammy. Thank you so much for joining today and answering all the questions and presenting. And yeah, and if in case anyone, if we get any questions in the future, I may reach out to you and forward those to you. But thank you so much for joining today and presenting. And I would also like to thank everyone who joined. I hope you got to know about the BCBSM plan. And if you still have any question, please feel free to reach out to us directly. You can send an email to me, that is ghg-vp@mtu.edu, or you can send an email to gsg@mtu.edu. Yeah, we'd love to get your questions answered. With that, thank you so much, everyone, for joining, and have a great rest of your evening.
Great. Thank you, too.
Thank you.
Take care. Bye.